Hi, I'm Noopur Desai, an oncologist at the Cancer Vet. So today we'll be talking about radiation therapy and its role in veterinary medicine. So what is radiation therapy? Radiation is when we give really high energy ionizing beams to kill cancer cells, which is basically like think of photons, which are your normal X-rays, but at a much higher energy than what we would for a normal radiograph. So we use photons, we use electrons, there are also protons that are now being used, but in the veterinary world we are using mostly photons or electrons. So why does radiation kill cancer cells? Radiation causes DNA damage to a point where the cell cannot divide, and while they're dividing, it undergoes death, cell death. Radiation cannot differentiate between normal tissue and cancer cells, but while we are planning, what we do is we ensure that the normal tissues get as little dose as possible and the tumor gets the maximum dose, thereby reducing the side effects. Now, there are different types of radiations that can be done. One is called external beam radiation, which is when the radiation comes down from a specific radiation machine called as a linear accelerator and kind of hits the target from outside the body. Then there's something like iodide 131, which can be injected. There's brachytherapy, where we actually embed the radiation beads into a cavity. Then there's strontium, which is like a little Harry Potter wand that can be used for very superficial tumors. But today we'll be talking more about external beam radiation, which is most commonly used in the veterinary world. So how is radiation done in our veterinary patients? In people, they'll lie still if you ask them to. In the veterinary patients, we would need to do this under general anesthesia. So all the radiation has to be done under general anesthesia. So normally in our practice, what we do is we do a CT scan first for radiation planning. And we need certain immobilization devices. These are called vac-lock mattresses or a head mold. And along with general anesthesia, these are used to ensure that our patients are completely immobilized so that we can deliver radiation with precision. Radiation planning CT scan is done with these immobilization devices, after which we as radiation oncologists will go in and actually contour. What that means is tell the computer where is the tumor, what are the normal tissues, where all are the normal tissues, after which we'll start with planning of the radiation. During planning, what we try to do is, again, give as much dose to the tumor as a prescribed dose to the tumor as possible, whereas minimizing doses to the normal tissues. Once the planning is done, then the plan goes through a quality assurance to ensure that the machine can actually do what we want it to do. Only after that does the radiation treatment happen. Once the planning is approved, the quality assurance is done, then depending on what protocols are chosen for radiation, those many anesthesias will be required. Every day before treatment, in most cases, we would need a quick CT scan done under the same machine, and this is done to ensure that the positioning is absolutely appropriate, because even millimeters of a difference can make a huge difference in terms of how we are delivering radiation. So a quick CT scan may be done. It's called image-guided radiation therapy to ensure appropriate positioning. Once we are happy with the positioning, after that, we would go ahead and treat. So what are the tumor types that can be treated with radiation? Actually, we can treat any tumor in the body, be it nasal, oral, brain, spinal cord. We've treated lung tumors, we've treated liver tumors, which can't be surgically removed, certain tumors in the abdomen as well. So before disregarding that, nothing can be done because surgery is not an option, maybe check with your oncologist if radiation is an option for you. The next question is, when is radiation used in veterinary medicine? We can use radiation wherever we can't do surgery. So think of tumors like brain tumors or certain intranasal tumors, certain oral tumors, where surgery may not be an appropriate line of treatment because of whatever reasons. Radiation can be chosen in that scenario. Radiation can also be given in the palliative setting, which means to alleviate pain, like in osteosarcomas or in certain bone lesions which are very painful. We can give radiation in those. In certain cases, radiation is also given to shrink the tumor. So certain tumor types are very responsive to radiation, like mast cell tumors, certain lymphomas, or even something like an injection site sarcoma in cats, where the tumors are very, very big and surgery can't really be done in those cases. We can give radiation first, try to shrink the tumor, and then talk about surgery. One more, I would say, function of it is to clean up cancer cells. So which means after surgery, if we are not able to get complete margins, we can radiate that tissue to clean up the cancer cells, thereby reducing the rate of reoccurrence of those tumors. Now let's talk about side effects for radiation. If you remember, we talked about side effects for chemotherapy, where the protocols are different than people. Same is the case in radiation. Because we need multiple general anesthesias, our protocols are much, much shorter than what they would do in people, as are the side effects. So whenever we are talking about radiation side effects, I like to divide them in acute versus late-term side effects. Acute side effects can happen about 2 weeks after finishing the radiation, and they get better in 2 more weeks after that, without really any permanent damage as such. Now, if you're treating, say, an oral tumor, some of the acute side effects that you might see is some alopecia, so loss of hair in that area we are treating, oral mucositis, which is when you eat, really hot pizza and your mouth can burn. It's something similar to that. If you're treating close to the eyes, you can see some conjunctivitis, you can see some reduced tear production. If we are treating close to the abdominal cavity or in the pelvic region, we can see some colitis, so inflammation of the colon, so on and so forth. It depends on the areas we are treating. These side effects don't happen outside of the areas where the radiation beam is actually shot. Because I get a lot of questions saying, oh, will there be vomiting? Will there be diarrhea? Similar side effects as chemotherapy. It usually doesn't happen. Normally, the side effects will be only in the areas where the radiation is actually given. So these acute side effects get better in about 2 weeks once we start seeing them. We would normally prescribe some pain medications. If we feel it's infected, maybe an antibiotic. Otherwise, we don't really need any significant care as such. One very important thing to remember is if they're showing any skin side effects, any oral side effects, is to wear an e-collar, because they can make things worse by scratching. Then talk about late-term side effects. These usually happen 6 months to a year after finishing radiation. And we try very hard for these not to happen because they're sometimes difficult to actually manage. So for example, if we're treating a nasal tumor, one of the common late-term side effects that we could see is a oronasal fistula, which is when the bone in the hard palate basically gets broken down, and there's a small hole that can join the oral cavity and the nasal cavity. Now, we can do things to fix this, but it's more challenging to fix the late-term side effects. The chances of late-term side effects are much, much lower. I would say about 10% chances of late-term side effects. So they're not really very common either. Then there are very different protocols that we follow for radiation therapy. These protocols are dependent on what are our goals, how big is the tumor, and the general health of the animal as well. Whenever we are thinking of protocols, again, I like to divide them in, I think there are 3 main protocols that we can do. One is called conventionally fractionated radiation or definitive radiation therapy. Now, the goal of definitive radiation is to give as high a total dose as possible. So again, in people, they'd maybe give 60 treatments. In our veterinary world, we normally don't give anything beyond 20 treatments. So definitive radiation would be something like if in an oral tumor we've left disease behind, in the microscopic disease setting we could give 18 treatments. For certain brain tumors we could give 20 treatments, but it means 18 or 20 anesthesias. That would be definitive radiation. Now there are newer protocols coming up which is called as stereotactic radiation. There's a lot of data coming out now for stereotactic radiation for brain tumors, for osteosarcomas, for nasal tumors. There's also data for heart-based tumors, liver tumors. So we're actually getting a lot of information about use of stereotactic radiation in veterinary medicine. The advantage of stereotactic radiation is that we try to give really high doses, so we have to be extremely precise in less number of treatments. So for definitive radiation, we might give anywhere from 15 to 18 treatments or 20 treatments. In stereotactic radiation, we can give about anywhere from 1 to 5 treatments. And these are usually given in a row in 5 daily treatments. Because we are so precise and because we are giving such high doses, some of the outcomes are very similar to definitive radiation. There's certain tumor types where we may not be able to do stereotactic radiation. So if the tumor volume is extremely big, in that case we might not want to do stereotactic radiation or even definitive radiation per se. One other protocol that we can do is palliative radiation, where our goal is palliation, where our goal is just to keep them comfortable. So in cases of, say, tumors, really big oral tumors with maybe metastasis, a small metastatic lesion in the lungs, we could opt for palliative radiation to kind of keep the quality of life, make the quality of life better. So for palliative radiation, we can do that in, again, let's say osteosarcomas of the limbs or certain anal sac tumors which have metastasized to the lymph nodes, which are very big and we can't do stereotactic. In that case, palliative radiation would be an option. Now again, with palliative radiation, we can either treat once a week for 4 weeks, or we could give 5 daily treatments, but with lesser doses than what we would give for stereotactic radiation. I'm not going to get too much in detail about the different protocols here, but this is just in short about the different protocols. The way the protocols are decided is based on what is appropriate, if the surrounding tissues can actually tolerate these doses or not, what else is going on with our pets. So check with your oncologist which protocol works best. Just because stereotactic is the new craze does not mean that it is the appropriate treatment choice for your pet. It just depends on a lot of factors in terms of what protocol we really choose. So in India, radiation is really not that easily available. So let's hope we get more and more places who will let us radiate pets, because it is a very important therapy, and we can actually give a lot of comfort to our pets with this treatment. So this is our last talk for the year. We'll see you next year again, where we'll talk about lymphoma, multicentric lymphoma in dogs.